Good morning. I'm here with Mayor Sylvester Turner. We also have social distancing off the shot for in case folks have any questions. Chief Acevedo, Chief Peña, the fire chief for the city of Houston, Chief Bunick from their Office of Emergency Management, Francisco Sanchez from the Harris County Office of Emergency Management, Dr. Peirce with the City of Houston Public Health Department, Dr. Shaw with Harris County's Public Health Department. I know Councilmember Cassick-Statham is here as well, and so those folks will be available to answer questions. I will speak, then Mayor Turner will, followed by Dr. Mark Boom, who is the CEO of Methodist Hospital, as well as a physician himself, and Dr. Porsa, who is the CEO of the Harris Health System, as well as a physician. First, let me thank everyone who is doing their part. I recognize a lot of people are staying home. They're avoiding crowds. They are helping us get through this in the best way possible. And to all of you, thank you. We need you, and we appreciate the sacrifices that each of you is making. A lot has happened over the last few weeks, and we know that more will happen, but we are taking all of this one step at a time. We are being thoughtful. We are being guided by data and information, by experts and science, and we are working very hard to stay ahead of this virus, to prevent us from getting to where the difficult, very difficult positions where other communities have ended up already. We have been in touch with several healthcare professionals. For example, Dr. Burwinkle with the School of Public Health at the University of Texas, who informed us very alarmingly yesterday, we must take steps now. Any delay in additional action would be incredibly problematic. The models he has produced require us and truly exhort us to take additional aggressive steps. The frontline entities who are fighting this disease are hospitals. The CEOs of each of the hospitals at the Texas Medical Center, as you all know, the largest medical center in the world, come together every day to discuss coronavirus. They've never been more united than they are today. And I speak with the CEO of the medical center, Bill McKeon, almost on a daily basis. They are seeing the rate of patients coming into their hospitals, and they have also sounded the alarm. So you'll hear in a little bit from Dr. Boom with Methodist Hospital, and he will share, as he shared with me, an exponential increase that he has seen in the number of patients coming into the hospital, the percentage of those who need to be treated in the ICU, and the length of time that patients have to spend in intensive care. We're seeing that patients here are having to spend longer in intensive care than in other places. What these experts, leaders, and folks in the front lines tell us is that if we keep going at the rate we are going, we will end up in the situation that New York is heading towards, that Italy is at, where we simply run out of ICU space, regardless of the surge capacity that each of them and all of us are helping to build, that we simply would have to get there. And so that is why it's incumbent on us to take additional steps above and beyond those we've already taken. We've been working very, very closely with researchers, with businesses, with local elected officials from throughout the region. But the most important factors are science and health. We are letting science, data, and health drive the decisions we make. Our North Star is the best data we have and what our medical community is telling us to do. So after consulting with these folks, we're taking today another step to prevent the spread of coronavirus. when we put out the bar and restaurant order with Mayor Turner a few days ago, we said that if we erred, we would err on the side of action. And in that spirit, we are taking steps to prioritize human life. And so I'm issuing a stay home, work safe order for Harris County, walking in lockstep with Mayor Turner and proud of the partnership that we have across our region. This order will apply throughout Harris County, including unincorporated areas and all the cities within Harris County. To put simply, this means that all of us should stay home unless our jobs are essential for the health and safety of our community. Those of us whose jobs are essential to health and safety must do everything we can to maintain 6 feet from one another and keep ourselves safe. So that's what we mean. Stay home unless your work is essential. And if your work is essential, you must work safely. Hence, stay home, work safe. We are following a simple model. By staying home, we are saving lives, we are flattening the curve of the virus, and we're making sure that we're not overwhelming our healthcare system and therefore our community as a whole. No one, including myself, wants to be in a position to sign that kind of an order. I know that it will cause hardship, more financial pain, that it will be difficult on top of what we're already facing. But on balance, we recognize that the minute we end up in a decision where we're having to turn people away from a respirator, from an ICU bed, and choosing who lives and dies, that we don't want to be in that position, that would be catastrophic. And the models we have show us getting to that position where we far exceed the number of ICU beds in this county unless we take drastic steps. To be honest, it was not a hard decision based on the data, because if we follow this, we will save lives. The order will be effective tonight at midnight and will go until April 3rd, which is as long as the governor's order is in effect to make sure that we are consistent with the state. We will, of course, revisit the order as necessary.